having your surgery on an inpatient basis or an outpatient basis, but we're going to touch on that as we go through, okay? So, right off the bat, it's all going to be basically the same for all of you, okay? So, whether you're having your surgery at 7 o'clock in the morning, or 11, or noon, whatever it is, normally you're going to spend about an hour in surgery, and then after that, you're going to spend about 3 hours in the recovery room, okay? So about 4 hours total, okay? That's where things start to diverge a little bit, okay? So for those of you having surgery on an outpatient basis, whether you're having a new knee done or a new hip done, normally the first person that's going to come in, help get you dressed, help get you up to the chair, okay? So that's the first thing that happens there. For those of you having, first person you will see will be your nurse. He or she's going to walk you through some medical intake questions, things like that. Make sure your vitals are stable. And the next person you'll see after that normally will either be myself or my counterpart, Joe, who's also a physical therapist. Okay? So, following, switching back to outpatient here, so following Jody helping you get dressed, get up to the chair, then the next person you'll see after that is physical therapy, myself or Joe. Okay? So, things come back together here a little bit. So, once each of you see us for the first time, we're going to look at a couple things to begin with. One, do we have sensation coming back in our legs when we have our surgery? Obviously, we don't want to feel it when it's happening, so we have anesthesia. If we have a spinal anesthesia, we end up with some numbness throughout our legs that lasts normally from 3 to 6 or so hours after your surgery. Okay, so first we're checking, are we getting that sensation coming back in your legs? Is that numbness going away? Also coupled with that sensation of, or that sensation that you have, that feeling, touch. Also along with those nerves, it gives us our sense of balance. Okay, so that's the bigger thing that we're checking on when do you have your sensation of touch. Okay, because then we know that your sense of balance is also going to come back as well. Okay, the other thing that we're going to look at is, do you have return of motor function? Okay, so meaning, can you coordinate and contract your muscles as you need to for our big endeavors that we're going to do? Because the big thing that we want to do is get you up and moving as soon as we can. Okay, so as long as we pass the test, we have sensation back and we can move our limbs as we need to. The next thing that we're going to do, both inpatient and outpatient, is we're going to get up and actually do some walking. Okay, so normally I'm not going to have you run a marathon that first day. Okay, so normally it's going to be about 50 to 100 feet. We're going to have you walk, show you how to use your walker, things like that. Okay, for those of you having outpatient surgery, normally we teach you how to walk, then we walk you through doing some steps, and then if you're having a total knee done, or if you had a total knee, we'll help you with setting up outpatient PT, and then that's normally about the end of it. Okay, for those of you having inpatient surgery, normally we get up and walk that first day, and then that's the end until the next day. Okay, but for all of you, in terms of being successful with walking that first time and following surgery, we want you to have one of these. Okay, so this is a front wheel walker. You got wheels on the front, normally you have skids or tennis balls, something like that on the back. So these are important for two reasons. Okay, so the first one is whether you're having a total knee or whether you're having a total hip, you're going to be what's called weight bearing is tolerated on that surgical limb following your surgery. Okay, so what that means is you can put as much weight as you can tolerate on that limb, just as you can tolerate, basically. Okay, so think about this for a second. So let's say my right leg is my surgical leg. So if I do this, I'm putting 100% of my weight on my right leg. Okay, if I do this, I'm putting 0% of my weight on my right leg. Okay, this 50%. So anywhere on that spectrum is okay. Now, normally, we probably don't think about it a whole lot, but we actually spend 60% of our time on one foot when we do walk. 30% on one leg, 30% on the other. So that's the normal to get back to 100% weight bearing. However, normally there's a couple other things involved. Normally it has pain or we're not moving quite as well. So getting back to 100% right away once we get out of bed isn't always achievable. Okay, so this walker, this style of walker, helps you do that. Okay, so say my right leg is my surgical leg. What you do is when you step with that leg, you push up with your hands, and now instead of 100%, maybe I'm only 70% of my weight on that leg. Maybe I'm 50%, maybe I'm pushing a little bit more. So that's a way that you can modify how much weight you're putting on that leg to keep us moving, but still in a tolerable range. Okay, so the front wheel walker is much more effective at that than those walkers that have the four wheels in the seat. Often those are a little bit too squirrely right off the bat. Down the road, absolutely, they're good. But right off the bat, when we want to take some weight off, they're not the best tool, okay? The other reason why we have you get these walkers is because we know that this is a big quality of life surgery, right? You want to have less pain, you want to move better, okay? And we don't want to hinder you right off the bat, okay? So these are still fairly mobile, okay? They fit in most houses, unless your house is really, really old and with really narrow doorways, but we can work with you on how to navigate with that. But they allow you to be much more mobile than those walkers that just have the four legs and then you're stuck like this. Okay? So, we want you to bring one of these with you on the day of surgery. We will find a way to get it to your correct room, so that way right off the bat when we get up, we can size it to you, we'll height, make sure it's the right width for you, make sure it's the right tool for you before you head out the door. Okay? So,
can we buy one like a Walgreens or CVS? Or?
Yes, so good question. So, if you do not have one, there's a lot of really good options in town of where you can get one, okay? So, first place, there's a place called Independence Rising on 312 Elm Street. You can rent a walker there for 4 months. You'll probably only be using it for 1 or less. But you can rent it for 4 months for $10. Okay, you're probably not going to find a better deal than that.
Say where that is again, please.
312 Elm Street. ELM. Yep. Other really good options that other patients have had success at is going to either Goodwill's in town, the one on South Locust, the one on West Street. Patients get walkers for less than $10 there. Also thrift stores in town. Or if you're affiliated with a local church, or maybe you're a veteran, local churches in town often have some DME, durable medical equipment. They can walk. So for the outpatient, practice stairs, help you with therapy, and normally that's the end, okay? Send you on your way. For those of you having inpatient, we see that first time, and then we will see you twice a day until you're ready for discharge, okay? For those of you staying inpatient, 90+% of our patients discharge that very next day, and actually most do discharge in the morning, okay? So normally not a very long stay either way, okay? So what do things look like after the hospital? For those of you getting a total hip, normally you will not have outpatient physical therapy, okay? Normally you will have discussion at the 2-week follow-up with your physician. If you really need physical therapy, that's when they will prescribe it to you, okay? For those of you getting a total knee, you can bet on it. It's going to be 3 times a week, normally from anywhere from 6 to 10 weeks, okay? Is anyone thinking about doing outpatient physical therapy in Grand Island? Okay, so a couple of us. So got a lot of really good options in town. So you have Rathdrum Physical Therapy, you have Grand Island Physical Therapy and their affiliates, you also have Athletico. You also have the company that I work for, which is Live Well Physical Therapy. What really sets us apart from the other places in town is that we're dedicated to a small care team, okay? When you come to us, we sign you a physical therapist and a PTA, and I mean, there's some other, occasionally someone's sick or something like that. But for the majority of your time in physical therapy at Live Well, you're going to have those 2 people that are going to be working with you, okay? We really feel that it's important that you have 2 people that really know your goals, that really know your care, and know where you want to go. We don't necessarily like the model of you come in and you see this person this time, you see that person the next time, and well, I thought you just worked at the front desk, and who are you? I thought I saw you outside. We don't necessarily like that. Okay? We like that continuity of care. The other thing that sets us apart from places in town is that at 2 of our 3 locations, we have the capability for aquatic physical therapy. So whether you're having a total knee or a total hip, right after your surgery, you're going to get a waterproof bandage. Normally it's the next day or the day of, and you can take a shower. Okay, but we don't want you to submerge that incision normally for about 4 weeks, okay? However, if you get to the point in your plan of care where it's 4 weeks in and aquatic therapy is gonna be something that would be beneficial to you, that is something that you're capable of doing at 2 of our locations, okay? Whether you're having surgery on an inpatient basis or an outpatient basis, if you would like, we will help you set up your appointment before you leave, wherever you want to go. 100% your choice, okay? Questions about anything so far? Okay. Having turned your books to page 23, I'm going to show you some exercises I want you to be doing ahead of surgery.
Yeah, I already been doing it.
Perfect. Get a gold star. Okay, so first one there is called ankle pumps. So it looks like this. So this one is going to be especially important after you have your surgery. Okay, so the main thing that this does is helps keep your blood moving, save off veins like blood clots. Okay. So, quick little anatomy lesson for you. So in your body, you have 2 main vessels that transport blood. Okay, so you have your arteries and you have your veins. So your heart pumps, pushes your blood away through your arteries, so there's pressure in those vessels. That blood goes to your muscles, your organs, your connective tissue, gets used, and it's going to find a way to get back, right? So as it comes back on your veins, or through your veins, I should say, but you don't have that heart pushing the pressure on it now, so there's not as much pressure, plus we also have gravity pulling down. So your body has to have a different mechanism to get that blood back to your heart to recirculate, okay? So what that mechanism is if you can envision that you have a long flexible tube coming up the back of your calf, those are your great veins of your calf, okay? Every so often you have a set of valves. So if you've ever seen a piece of bamboo cut in half and it's just section, think about your deep veins in your calf like that, okay? When you engage your muscles, you squeeze that flexible tubing, pushes blood up, set of valves catches it, you relax, you do it again, pushes up that next section, set of valves catches it, so on and so forth. That's how we keep blood moving. That's how we keep it from stagnating in our legs. Stave off those blood clots. Okay. Next one is called quad sets. So I'll show you on my right leg here. We'll say my right's going to be my surgical. So I want you to envision that you have an egg, a towel roll, something like that underneath your leg, underneath your knee. You're going to tighten up this top thigh muscle, push down, hold for a couple counts, and then relax. Tighten up this top thigh muscle, push down like you're going to squash that egg, squash that towel roll, hold for a couple counts, relax. Next one, similar concepts, we're just using a different muscle group. So it's called glute sets. So now we're using our buns. So tightening up your buns, holding for a couple counts, relax. Tightening up your buns, holding for a couple counts, relax. And I guess I should say, this is maybe the most important thing, you do not have to get on the floor to do these, okay? Normally the best place to do these is either in bed or in a chair where you can recline a little bit and get your legs out in front of you, okay? Next one is called heel slides. So I'll say my right leg is my surgical. What you're doing is you're sliding your heel back towards you and going back out. Okay, for those of you getting a total knee, when you come back to this point, try to allow yourself to have a little bit of a stretch, okay? Now, it doesn't have to be intolerable, but it should be a little bit uncomfortable, okay? The more range of motion that you have going into surgery, normally the easier it's going to be to get that range of motion following surgery and physical therapy, okay? Next one after that is called straight leg raise. So now you're keeping that leg straight, lifting up, going back down. Lifting up, going back down, okay? If either of those last two are difficult for you, one trick that you can do to help yourself out, take a regular belt that you can wear around your waist, take the tail, slide it through the buckle so you have a loop and then a long tail, put the loop over your foot, and now you can help yourself if you need it. Either one, okay? Just remember the purpose of the exercise. Working our legs, not our arms, okay? Last one there in the book for you. Just getting up out of the chair. So it shows you using your arms, raising your buns out of the chair, and back down. Okay. That's easy for you. Take it one step further. stand all the way up. Still use your hands. That's okay. Or if that's easy for you, take the hands out of the equation. Okay, so wherever you best fit on that spectrum, go with that, okay? Last little thing for you. So, I want you to envision how you're going to get in your house, or your home, or your apartment, whatever it is. Is it going to be through the front door, side door, through the garage, whatever it is. Excuse me. Do you have steps to get in that door? If you do have steps, do you have a handrail, or do you have some place where you can put your hand and give yourself leverage? Okay. Joe and I can show you 100 different ways how to go up and down stairs without having a handrail, but I promise you, just having one place to put a hand and give yourself some leverage is going to be much easier on yourself, especially that first week after surgery. Okay. So if you do not, I would recommend getting one installed temporarily, or you can even go to Home Depot, Menards, Ace Hardware, wherever. You can probably get, you've seen those like handles that you suction cup in the bathroom. They make some of those where you can just screw them into the wall. Something like that, 2 screws, and 10 minutes later, and you're going to make your life a ton easier that first 2 weeks or so after surgery. Okay. So that is my spiel for you. If you would like to get scheduled for physical therapy now, and you would like to choose Live Well, I'll be right around the corner at my laptop if you want to schedule ahead of time. Otherwise, again, we'll help you on your day of surgery wherever you'd like to go. Okay? Any questions for myself? Yes, sir.